It just seems like the whole concept of natural immunity is largely being ignored in policy, and which seems very odd.
It is very strange. We have known about natural immunity since the Athenian plague in 430 BC. And I'm not talking about before COVID, I'm talking before Christ. So for almost 2,500 years, we've known about natural immunity. So it's strange that suddenly people are questioning that. The purpose of the vaccine is to have a milder disease if you get infected. But if you already have been infected, because maybe you were infected before the vaccine existed, then you already have excellent immunity. You have stronger, longer-lasting immunity than you have from the vaccines. So this idea that you're going to fire a nurse who was working in the COVID wards for many months taking care of COVID patients who got infected, who recovered, and who now have better immunity than those hospital administrators who were sitting at home or doing Zoom meetings and who then didn't get COVID but got vaccinated. They have less immunity than this nurse who was at the front line taking care of patients, but now those administrators are firing those nurses, even though they have better immunity. So we should do the opposite. Hospitals should hire nurses and other staff with natural immunity, and then they should assign those to the geriatric wards where there are older people who are extra sensitive, who are frail. And even if they're vaccinated, they might be at risk of dying from COVID. So we should utilize them to take care of older patients who are at risk. The same with nursing homes. Nursing homes should go out and try to hire people who have natural immunity. They're the ones who are least likely to infect the residents. And we're doing the opposite. They're being fired. I don't understand how any hospital president who supposedly should do what's best for the patients in the hospitals and take care for them, and who supposedly should be enlightened and informed about these things, how they can do the very opposite of what is best for their patients. Same with university presidents. They're supposed to be the beacons of the enlightenment and of knowledge, and they're going contrary to these basic facts that we have known about for a couple of thousand years.
So this is pretty fascinating, because you're basically saying that the hospital health workers with natural immunity can be kind of like the front line of the focused protection program going forward, basically.
Yes, yeah. And actually that's what they did during the Athenian plague, 430 BC. They used people who had recovered from the plague to take care of sick patients.
Fascinating. So when it comes to infection, okay, is natural immunity better in preventing infection than vaccination? Is that what you're saying?
Yes. So there was one of the best studies was from Israel, and they looked at and they saw that if you're vaccinated, you're 27 times more likely to have symptomatic COVID disease compared to if you have natural immunity. With the confidence interval between, I think it was 13 and 54 or something. So it's a big difference. And when looking at the hospitalizations, there was also more protection from natural immunity than from vaccine immunity. When it comes to death, there was 0 death in both groups, so both the vaccinated and those with natural immunity were well protected against death, so that's good. But yeah, so the immunity is stronger and it's longer lasting than if you have a vaccine. And that's not a surprise. That's what we would expect. The vaccine sort of targeted a specific part of the virus, while natural immunity sort of have a more broad protection. It also has to do where the body encounters the virus for the first time. And if it's a natural infection, you encounter it first in your lungs typically. If it's a vaccination, you do it in the arms. So that might also have to do something with comparing the protection from the two.
Well, sure, but what about, so you're talking about, symptoms here, but what about just infection itself? A lot of people out there are very concerned about getting infected with COVID.
Well, the vaccine, it works, or the immune system works so that if you get the virus in the body, then that's when the immune system sort of goes into effect. It's not like a Star Trek shield around you that prevents the virus from entering the body. the immune system cannot operate until the virus in your body. And when the virus enters, it takes some time for the immune system sometimes to sort of get up to speed. It depends on how long ago you had the vaccine or how long ago you had the natural disease. But the fact that somebody tests positive is not really, in my mind, very interesting. If we would test for all the viruses and anybody who was asymptomatic but tested positive because they had been exposed, we would go nuts worrying about all these viruses around there. So it's really the symptomatic disease that we should be concerned about, as well as, of course, hospitalizations and death, which is the most important.